Hello, my name is Sabrina and I'm going to be your nurse for today. Can you tell me your name and date of birth?
My name is John Earl Johnson. My date of birth is 2/24/1983.
So today you're here for a cardiac and peripheral assessment. We're going to be doing some education, and if you have any questions or anything hurts during the assessment, please let me know. Okay? So first we're going to start with your upper extremities, which are your arms. You can hold your arms out for me. So both of them are symmetrical. You have good hair distribution on each side. I'm going to check your turgor of your skin, which is normal. I'm going to get you to squeeze my fingers. Good, that's normal. Then your capillary refills on your nails. It's less than 3 seconds. And then your skin is warm and dry to touch as well. So I'm going to get you turned over and we're going to check your pulses. These are your radial pulses, and these are your brachial pulses, which are good and normal. All right, so you can put your arms down. We're gonna go to your carotid. So this is your carotid arteries. I'm looking at them. I don't see any abnormal pulsations. I'm gonna touch them just to see if you have good blood flow. Okay, those are good. And now I'm going to listen to them. I'm going to get you to take a deep breath in and blow it out and then hold it when I put my stethoscope there, okay? So, deep breath in, blow it out, hold it. Okay, now, do it again on this side. Deep breath in, blow it out, hold it. Okay, very good. Next, I'm going to tell you about some heart sounds. Before I listen to them, I'm going to tell you where they're located, okay? So this is your aortic. It is on the second intercostal space on your right sternum border. This is your pulmonic. It is on the second intercostal space on your left sternum border. This is your Erb's point, which is on your third intercostal space on your left sternum border. This is your tricuspid, which is on your left lower sternum border, and your mitral, which is on the fourth to fifth intercostal space on your mid-clavicular line. Now I'm going to listen to those, and I'm going to call them out again, okay? So your aortic, pulmonic, Erb's point, tricuspid, and your mitral. Now listen to it again with the bell of my stethoscope, which is your aortic again, pulmonic, Erb's point, tricuspid, and your mitral. Okay? All right, Mr. Johnson, so I'm going to have you lay down. So here we're looking for jugular distension, and I don't see any. That's good and normal. Next, I'm going to check your pericardium area, which is where your heart is located, okay? So I don't see any abnormal pulsing. And then we'll just feel around any abnormalities there. It doesn't hurt? Okay. All right, so the next thing I'm going to do is listen to those same spots, okay, that I was telling you about earlier. So this is your aortic, pulmonic, Erb's point, tricuspid, mitral. And again with my bell, aortic, pulmonic, Erb's point, your tricuspid, and your mitral. Alright, so I'm going to get you to roll over to your left, and I'm going to listen for your apical pulse. So that is right here. And this is also called your mitral which is located on the 5th intercostal space on your mid-clavicular line. All right, that's good. Now I'm going to move down to your lower extremities. And so your legs are symmetric bilateral. You have good hair distribution. I don't feel any edema, no varicose veins. Your skin is normal and dry to touch. So next we're going to do your pulses. So this here is your femoral pulse right here, which is your popliteal. Good. Your post-tibial pulses and your dorsal pedis pulses. I'll get you to take your shoes off here. And we're going to feel for those. Okay. All right. Can I get you to sit up, Mr. Johnson? All right. Do you have any questions? Okay. Thank you very much. Okay, so I'm giving a report on a 42-year-old African-American male who came in for a cardiac and peripheral assessment. First, we did his upper extremities. His arms were symmetrical. His hair was evenly on both sides. His skin was warm and dry to touch. His turgor was normal for his age. His capillary refills were less than 3 seconds. His grips were bilateral, equally and bilateral. His radial and brachial pulses were equally and bilateral. Next, we moved to his carotid arteries. On inspection, there was no pulsating. I palpated, and they were equally and bilateral pulses. During auscultation, they were no murmurs were noted. Next, we moved to his heart sounds. I gave good patient education. I auscultated lying and sitting. There was no abnormal murmurs noted. There was S1 and S2 were noted. Next, we moved to him lying down. I checked for jugular distension. There was no distension noted. We did his precordium, palpated, no tenderness, no pulsation was noted. I did check for his apical pulse, which was located on the 5th intercostal space, mid-convicular line. No abnormal murmurs were heard. Next, we moved down to his lower extremities. His legs were symmetrical. His skin was cool and dry to touch, warm and dry to touch. His hair was distributed evenly on both sides. I didn't notice any varicose veins. There was no edema during touch. I did his pulses, which was his femoral, his popliteal, his post-tibial, and his dorsus pedis, all equally and bilaterally.